Okay, this is take 5, and I hope that my camera does not disconnect. Okay. Hello, John. Are you ready to go over your results today? Okay. So before we start, I just want you to know that if you have any questions, please stop me. We will go over that question. If it is a question that will be answered, in the following page or the following section, I'll let you know, and then we can address it then. If you do not understand something, or if something seems confusing, please stop me. I will gladly break it down. If at any point in time, because these are sensitive topics, if at any point in time you feel uncomfortable and you would like a break, we absolutely can do that. You can take a 5-minute or however long you need, and then we can come back and finish going over the results, okay? So please feel free if you need to get out. The bathroom is right down the hall. Okay? Okay, yeah. So, this first page, this goes over your scores and data flow. So what your and how your answers added up and came together for our score. We use T-score. It's a statistical tool used to measure our assessment. So and it matches up. So you did the Beck's depression inventory, the Beck's hopelessness scale, and the Beck's anxiety inventory. So the numbers look relatively the same, as you can see here, yep. And you do see the difference here. It states severe, moderate, but the numbers kind of look the same. The reason being is that each individual assessment is matched up with other clinical assessments, and by that meaning other tools, like other questionnaires that are used regularly. Beck's is among the most trusted psychological instrument tools in the world. So these are, they usually are pretty accurate, but again, it goes off correlations, and correlations are never the cause of things, and they just kind of show results in data number forms. Okay. Do we have any questions about the graph? Yeah, of course we can go over that. So we'll look at this so you can see your raw scores here. Your raw score is followed by the T-score that the computer generates, and then what the computer will then do is generate where you fall in the percentile, and whether or not that's what diagnostic range that's in. Diagnostic really means it's diagnosis. So like if you'd be diagnosed with depression or anxiety, that's where it falls. You would fall in the category of whether or not we would give you the clinical diagnosis of depression. And diagnoses are used mostly for insurance purposes, like if we need to classify, and it's also really a lot of what we as professionals use, so that way we can discuss. Oh yes, you knew that. Oh, all right. So if we want to read from the top, the following graph and table presents your T-scores, which are based on the norms for a non-clinical sample. This information may be useful in estimating the severity of client systems. So, like I said, and we match it up to other assessments to see where you range. The T-score is really, it's like a standard deviation. Are you familiar with that? Yeah, no, I like to explain it like a seesaw. Say your seesaw that goes up and down like this, and then that middle point, like that middle, right, the fulcrum point, yes. So I like to consider that like the standard deviation. It's where, the mid-range or like average scores. So, on what is average for somebody with symptoms of different severities. Yeah? Okay. So we'll move on from there. This next piece is the interpretation piece of what your assessments went over. I'm going to read it word for word, so that way we can, if you get confused at all, we can go over it right away, okay? And again, if anything feels uncomfortable or you want to take a break, we absolutely can do that. Okay. So John Sample, you, endorses the following statement for the Beck's Depression Inventory 2. I would kill myself if I had the chance. I know that's kind of it's a hard statement to say. And the reason being is just given your responses on the questionnaire, that you do have suicidal ideations. We don't have to talk about that right now. We do have clinical staff here in the agency if you do want to speak with someone before you leave, so please don't feel that you're alone. And if this is wrong, we'll discuss it, okay? Okay. So, elevated levels of depression, hopelessness, and anxiety indicate that John Sample is experiencing considerable distress. He may feel quite dejected and highly anxious and view the future as holding little promise of improved life. Do you feel that that is true? Yeah. Okay. Oh, yeah. So as noted above, the patient endorses one or more statement reflecting active suicide ideation. So in the questionnaire, you answer questions on the scale when it asks, I do not feel sad, I feel sad, I am sad all the time, and I can't snap out of it, or I am so sad, unhappy that I can't stand it. Starting with 0, 1, 2, and 3. And that is scored with the value of 0 to 3. Right, yes, no, I know I was explaining to you, but I just wanted to repeat, just in case. So, the combination of suicidal thought and high levels of depression, hopelessness, and anxiety is a clear danger signal. In long-term studies, the Beck's hopelessness scale scores in the moderate and severe ranges have been found to be associated with significant risk for eventual suicide. The suicide risk is even greater if the patient has a history of impulse control problems because of high level of anxiety. It's consistent with impulse suicide behavior. Suicide prevention should be an immediate focus of treatment. So, yeah, we can absolutely discuss this. That's fine. I understand. I just wanted you to, so that way you know. Okay. Yep. So, yep. These are the ranges. So, above 34, below 25 is for the Beck's depression. The hopelessness scale above 15 to below 18, and the BA above 21 or below 12. That's where. So if you since you scored a 32. You scored a 32 on the depression scale. That's in severe depressive symptoms. With your anxiety scale, you scored an 18 on that, and ranges in the moderate of anxiety, because where that falls is between 16 and 25 is the range. Okay? Right. Yes, you've been thinking it. Now, do you want to get in these things can be kind of heavy, so if you don't want to discuss the statements on here, we absolutely don't have to go into that. We can just skip right on to, yes, we can do that. Okay. So why don't we discuss the Beck's depression inventory? Let's get into that, because you did rate severe here, so it is a big concern, and we want to make sure that we can assist you in getting you treatment or whatever steps you want to take. Okay. So you did range in severe for depression. with a ROS score of 32. The Beck's anxiety inventory level is at moderate, which is really normal when paired with the severe depression. Anxiety kind of can be a big factor. Oh my god, this is tough. Actually, I have stage fright. So, now, do you have any questions about the actual test that when you took it, like about the questions? Yes, of course. Well, you know that when you took it, it was a questionnaire form, and asking you questions, and you rated it. So, like with anxiety, it asked you 21 questions, and you needed to rate whether or not at all, mildly, moderately, or severely, and those were rated on a 0 to 3-point scale. And the more, like, when the higher the score means the higher the symptoms. Yes, we absolutely can put you with some of our counselors here. That's absolutely positive. We can do that. Yes, you can have a copy of your results if you'd like. We can do that. Oh, my papers are all mixed up. This was really hard. So, Sean, do you have any questions for me before we can go and you're feeling really upset about the results? Yes, it can be very tough reading these results. Do you feel that the assessment was wrong in any sense? Do you feel that your results do not accurately report your symptoms and pain? You do feel that it is accurate? Yeah. Okay. Well, why don't we have a game plan? I don't want you leaving here today without one. We're going to set you up with a treatment plan. Is that something that you can agree about? Oh, good. Okay. Well, we will do that. Why don't we start